We will continue now. Move on to the next case in CBC interpretation. Move on to next case in CBC interpretation, that is case number 7. So let us look into this case. This is a 1 year 7-month-old child with hepatosplenomegaly. 1 year 7-month-old child with hepatosplenomegaly. He has got high fever for 15 days off and on, and there is no rigors. There is no rigors वगैरह नहीं है. Occasionally there is loose stools. Occasionally बच्चे को loose stool हो रहा था. 1 year 7-month-old child with the hepatosplenomegaly. Why there is hepatosplenomegaly? Okay. He has got high fever for 15 days. 15 दिन तक fever रहा, high fever. Off and on आता रहा fever. Okay. Fever is off and on means fever is not maintaining any rhythm. है ना, ऐसा कुछ rhythm नहीं है. Off and on आता रहता है. ठीक है. Occasionally there is loose stools also. Okay. And there is past history of repeated fever. There is also the past history of repeated fevers. So mother is giving this history. On examination, liver is palpable 4 centimeter. Okay, liver is enlarged. Spleen is also palpable 5 centimeter. That is also enlarged. Hepatosplenomegaly. Okay. Child is sick looking. So when I say child is sick looking, definitely this is a bacterial origin, or maybe some of the parasites also. Okay, significant lymph nodes. Lymph nodes are enlarged. Pallor is also present. Pallor is also present. So any idea? One year 7-month-old hepatosplenomegaly. 15 days, high fever. Rigors नहीं है. There is no rigors. Some of you may be thinking about malaria and all. तो rigors वगैरह नहीं है. बच्चों में ऐसा rigors आ भी सकता है, नहीं भी आ सकता है. Occasionally there is loose stools. Past history of repeated fever है. Liver spleen palpable है. Child sick looking है. Okay. Looking into the CBC reports. HB is 8 gram. Okay. MCV is 82. MCH is 28, MCHC is 29. MCH 28 borderline, MCHC 29 borderline, MCV 82 90 होना चाहिए, ये भी थोड़ा borderline में ही है, ठीक है. If you look into WBC 2600, WBC is very very low, 2600. Polymorphous 56, lymphocyte 39, monocytes 5. Okay, monocytes. Neutrophil monocyte 5. Okay. Monocyte 5. Platelets are 1.1. Platelets are very much decreased. 1.1. Now, any idea? What do you get from this? WBC is decreased. Platelet is also decreased. HB is 8 gram, not normal. Normal से तो कम ही है. MCV, MCH थोड़ा borderline पे है. Any idea? Okay, so go for the case. So in this case, WBC is less, isn't it? In this case, WBC is less, which is a little worrying. Platelet is also little low, that is also worrying, and HB is also low. But PBC का peripheral blood smear का picture दिया नहीं यहाँ पे. It is actually normochromic normocytic. Normochromic normocytic. In the last class we have seen the normochromic normocytic. अगर picture आ गया तो क्या सोचना चाहिए हमें? We have seen in the last day very clearly कि reticulocyte count देखना है, उसके बाद bone marrow करके देखना है. रेटिकुलोसाइट नॉर्मल है या डिक्रीज रहे तो बोन मैरो जाना है. बोन मैरो अगर नॉर्मल है, ठीक है, तो क्या देखना है. अगर बोन मैरो एबनॉर्मल है तो क्या देखना है. सो सम ऑफ द सिस्टमिक डिसऑर्डर्स वी हैव सीन व्हेन normocytic anemia is seen. We have to look into so many systemic disorders. This may be disorders of the liver, disorders of the kidney, disorders of the GIT, some other problems. Okay, chronic problems we have to look into, inflammatory. So this gives a qualify the PAN set. Now in this case HB कम है और WBC भी कम है और platelets भी कम है. So now this is a case of pancytopenia. This is a case of pancytopenia. Okay, all the three cell lines are decreased. Okay, now but if see in this case the cell line is affected, single cell line is affected, it is not much significant pancytopenia. That means WBC बहुत कम है, single cell line बहुत ज़्यादा affect हुआ है. But if you look into RBC, it is not much decreased. If you look into platelets also, it is not much decreased. Platelets 50,000 तक आ जाता है, इसलिए बड़ा issue नहीं है. ये तो 1.5 के ऊपर है. So there is no significant decrease in all the three cell lines, but WBC significantly decreased. Okay. So the common cause is enteric fevers. I think neutropenia मिलता है टाइफाइड फीवर में, न्यूट्रोपीनिया है ना, zero neutrophils, that is quite common. So neutropenia, then relative lymphocytosis with the neutropenia. Okay, so enteric fever may be there, biliary tuberculosis, malaria, kala-azar, viral infections, HIV, some of the drugs like cephalosporin and others may also lead to this type of presentation in the CBC picture. Okay, so there is some infection, no doubt, बच्चे को fever वगैरह है, some infection is there. So this is some infection, you treat the infection and then again repeat the counts. That's it. Because idea is it's a normocytic normochromic anemia, isn't it? When it is normocytic normochromic, there is no problem in the bone marrow, there is no problem in the hemoglobin. Now we have to think about the other things. Reticulocyte count, वो हमने किया नहीं है. ठीक है, reticulocyte count अगर normal है या below normal है और रेटिकुलोसाइट बहुत ज़्यादा है, रेटिकुलोसाइट काउंट बहुत ज़्यादा है तो हीमोलाइटिक पैथोलॉजी में चला गया. रेटिकुलोसाइट नॉर्मल है तो बाकी कुछ सिस्टमिक मैनिफेस्टेशंस हो सकता है, लाइक लिवर पैथोलॉजी है, किडनी पैथोलॉजी है, एक्सेट्रा. एनीवे, okay, so this type of picture will be also seen in case of CBC many times. ये भी कॉमन है. इस कंडीशन में क्या करना है, यू ट्रीट द अंडरलाइंग प्रॉब्लम एंड देन यू रिपीट द काउंट. जब आप रिपीट करेंगे एक दिन के बाद CBC, if the same count is then also it is seen, then it is significant and you have to think about it. Or if it is changed into normalcy, then no problem. Now going to the next case, that is case number 8. 3-year-old male, fever since last 15 days. There is weight loss for 1 month. Okay, there is leg pain. There is petechiae for 5 days. Some bleeding spots are also there for 5 days. And generalized lymphadenopathy. All the lymph glands are getting enlarged. Liver spleen is also get enlarged. On examination, pallor is present, petechiae is present. Liver is 2 cm palpable. Spleen is also palpable. There is no much bony tenderness, but significant lymphadenopathy is there. And even there is testicular swelling is also there. Testicular swelling is also there. By this, do you have any idea? Child is having weight loss. Child is having leg pain especially at the night hours. Child is awakening because of leg pain. Yes. What is the condition?
Hemorrhagic हो सकता है, petechiae है ना?
Petechiae, hemorrhagic.
Hemolytic condition, liver or spleen.
Liver spleen enlarged. Okay, then hemolytic, most of the time it occurs, if it is acquired, like autoimmune, it occurs very fastly. But a congenital hemolytic problems may occur very slowly. Very good. Okay. About the lymphadenopathy, petechiae is there, leg pain is there, weight loss is there. Okay, look into the CBC now. I hope you will get some idea now. HB is 7, MCV is 85, MCH 23, MCHC 24, WBC 2.8, very, very low. Platelets, very, very low, 45,000. Lymphocytes 80, P15, polymorphous 15, monocyte 5. HB decreased, WBC decreased, platelet decreased. MCV, MCH, this is almost all showing a normocytic, normochromic. But MCH is decreased 23 from 30. MCH is 33 to 24. MCV is 85. It should be 90. Yes, any idea now? About the cell lines, now look at the cell lines. All the three cell lines are affected or not? HB is also affected. RBC, WBC is also affected. Platelet is also affected. Almost all the three cell lines are affected, and all the three lines are showing the decreased values. Okay, so now this is a typical case. Okay, when there is a weight loss, always think about malignancy or chronic disease. Weight loss is there, and chronic infection like tuberculosis, etc. Either you think about the chronic disease or think about the malignancy. Leg pain at night, which makes the child awaken. I'm stressing on that fact. Leg pain, ठीक है, lower limbs में जो pain है या leg pain है, that's very typical of leukemia. Very typical of leukemia. ठीक है, जो leg pain है जो शाम को होता है, that is growing pain. No need to worry about that. But child is sleeping at 1 o'clock or 2 o'clock at night hours. Child wake up and crying because of leg pain. Okay, that is because of the stretching of the bony cortex because of leukemia blast cells. Leukemia का जो blast cells है, जब वो proliferate हो रहा है अंदर, उसका जो stretching की वजह से जो pain आता है, that's leg pain. And this is the typical pancytopenia. HB is low WBC, low neutrophil, and low platelets. So this is nothing but a case of a leukemia. बाकी जो symptoms है leukemia का, like lymphadenopathy, that is also there, but of course bony tenderness नहीं है. But petechiae, bleeding spots is there, leg pain is there, weight loss is there, fever is also there, mild fever is also there since last 15 days. So what else you need to diagnose leukemia? Only thing is, if you go for this CBC report till more thoroughly or more specific, then blast cells are not given here. You can find some of the blast cells are also, but it's intentionally not given here to make you confused. So this is a picture of a leukemia. P is only 15. Okay, lymphocytes are 80. P is only 15. Okay, and then we move to the last one more case number 9 now. 7-month-old female child with the history of pallor since 2 months. Since last 2 months, child is having a history of pallor. Child is having a failure to thrive since last 3 months. Last 3 months, child is having failure to thrive. There is petechiae since last 5 days. सिर्फ 5 दिन से जो है बच्चों को petechiae, इससे पहले नहीं था. And also there is some convulsions like hypocalcemia convulsions at the 2nd month of age. Now child is 7 month. 2nd month of age में बच्चे को जो है convulsion आया था. That is hypocalcemia. Because of hypocalcemia, calcium कम हो गया. That leads to convulsions. Now on examination, there is pallor, there is petechiae, liver is palpable. Okay, petechiae भी है ना, liver spleen palpable, lymphadenopathy नहीं है, but nystagmus is seen. Okay, nystagmus है. Now any idea? 7-month-old female child, pallor है, FTT है, 5 दिन से पेटीचिए है, हाइपोकैल्सीमिक कन्वर्शन का एक हिस्ट्री है 2 महीने में, लिवर स्प्लीन पाल्पेबल है, लिम्फ नहीं है, निस्टैग्मस इज सीन. एनी आइडिया? Okay, if not, you look into this particular CBC picture. HB is normal, HB is 5 ग्राम, पता नहीं है, बट नॉर्मोसाइटिक नॉर्मोक्रोमिक है. ओके, MCV is 85. Reticulocyte count is 5%, raised reticulocyte count. WBC less, 2.8. Polymorphous 25. Okay, lymph is 80, raised. Monocyte 5. Platelets 45,000. Blasts are seen. Yes, any idea? So when I say blasts are seen, and WBC is less, platelet is also less. Now everybody will have a thinking exactly like this. What is that? On the first look, it looks like it is pointing towards leukemia, isn't it? Pointing towards leukemia. Now again, remember these 4 conditions. There are 4 conditions where you see lymphoblast on the peripheral smear. Peripheral smear में आपको blast cells ही मिलेगा. ओके, ब्लास्ट सेल्स ही मिलेगा. पेरिफेरल माने जो ल्यूकेमिया में जो मिलता है ब्लास्ट, वो पेरिफेरल स्मीयर में आपको मिलेगा विदाउट ल्यूकेमिया. सो वन थिंग इज वेरी क्लियर, व्हेन ऑल द टाइम यू गेट ए ब्लास्ट, इट इज नॉट ऑलवेज ल्यूकेमिया. Blast can be seen in case of juvenile myeloblast monocytic leukemia, myeloid dysplastic syndrome. It can be seen in case of osteopetrosis, it's not osteoporosis, osteopetrosis. Blast can be also seen in recovering marrow. Marrow जो है कुछ डैमेज हुआ था वहाँ से रिकवरिंग हो रहा है. फॉर एग्जाम्पल यू आर ट्रीटिंग फॉर दिस ल्यूकेमिया, तो उस टाइम में भी ब्लास्ट आ सकता है. और सम ऑफ द अदर हेमाटोजेनस कंडीशंस देयर विदाउट ल्यूकेमिया यू कैन गेट द ब्लास्ट. दिस इज ऑस्टियोपेट्रोसिस, जो बोन ओवर बोन बोलते हैं हम उसको, ऑस्टियोपेट्रोसिस कंडीशन है. यहाँ पे भी जो है आपको ब्लास्ट सेल्स मिलेगा. ओके, सो दिस आर सम ऑफ द इम्पॉर्टेंट इश्यूज. दिस लास्ट केस आपको यही बताने के लिए कि देयर आर मेनी कंडीशंस विच मिमिक्स ल्यूकेमिया. कहाँ में ल्यूकेमिया का मिमिक होता है? ल्यूकेमोइड रिएक्शन, ठीक है, और दिस ऑस्टियोपेट्रोसिस, और बहुत सारे 4 कंडीशन जो अभी बताया मैंने. Okay, myeloid dysplastic syndrome, bone marrow recovering, some of the hematogenous conditions, juvenile myeloblast monocytic leukemias. So that may shows the blast cells, but it's not leukemias. Okay, so this is all for today. In the next class, we'll see few more of the cases. That completes the CBC actually. 2 or 3 more cases are there. So that we'll see in the next class.